Hello, everybody. This is Dr. Kahlon from IMG Rank to Match, and this is the fourth episode of the Rank to Match podcast. Here I am again discussing some of the most important things that will help you along the way of your residency interview journey. Today, what we're going to be discussing is especially important because it's not just preparing your application and putting it through, it's also presenting who you are as a person or a candidate to the program that matters a lot in this process. So, answering the questions that you asked during the interview and conducting yourself well during the interview becomes very important. Today, we're going to be discussing about some of the most common mistakes that students make while answering their questions and how to answer some of the most common questions that you would be asked during your residency trail in an effective manner. Now, let me begin by talking about the mindset. I believe that mindset and how you approach the match is very important, and the same thought process applies to you answering your residency questions and conducting yourself during an interview. Now, residency questions are not merely designed to get to know you as a person, but they are also opportunities for candidates to highlight their strengths. And this is how you as a candidate should think about them. To understand the process of the interview better, we have to dissect it into components. What are the components of a residency interview? Now, an interview is composed of the interviewer, that is a program director or somebody in the program leadership who you would be interviewing with, the interviewee, that is you or the candidate, and the setting or the location at which this is taking place. Now, it is essential to realize that your approach matters a lot, and not just to the whole residency interview process, but also in terms of answering these questions individually. One way to approach this process correctly is to think of this process as not merely a casual interaction, but as an opportunity for you to highlight your strengths as a candidate. Each answer should be constructed to highlight what you bring to the program while you carefully answer the questions you're asked, which at times might sound unrelated. There is some amount of selling yourself involved in the interview process, and that is why your job is to figure out how you're going to do this in a manner that is subtle and does not feel unnatural. For each question that you're asked as a part of your residency interview, you should focus very much on the content of your answer to that question. What makes the interview process different is that it's not merely the content that matters, but it is just as essential to deliver that content well. Many resources contain hundreds of residency interview questions and answers, and it is human nature to think that more is better. But this is not the case. As a candidate and as a physician who would be practicing efficiently in the future, you should learn to realize that your time is important and also come up with ways to plan on efficiently using this time. The first thing I recommend if you own such books is to look at the questions and sample answers in these books. While these may be excellent resources for you to look at initially, when you dissect each of the questions and answers, it is apparent that most of these questions usually draw their answers from similar ideas. What is vital for any candidate to realize is what these ideas are. Usually such ideas contain your strengths, your personal experiences, your professional experiences, and some unique life experiences that have molded you into the person you are today. What could be a good exercise for every candidate before approaching the interview process is to sit down and make bullet points or write down these ideas in a very abstract manner. You can summarize your strengths and weaknesses and what you bring to the table. It is also worthwhile to reflect upon the profound experiences, both personal and professional, that you have had in your journey as a physician so far, and how these experiences have made an impact in your life, and how what you learned from these experiences can translate to you being a good resident or a physician. It is easy to get overwhelmed during the interview process. Hence, it is crucial to plan and make sure that adequate time is allotted, not just to reading sample questions and answers, but also to other important aspects of navigating the process. An example of this could be failing to learn how to professionally deliver your ideas across to the interviewer, developing a professional communication plan, and communicating your interest to the programs that you are applying to. Usually, most candidates would be asked similar questions repetitively during their interviews. For my clients, I do not recommend them to practice more than 15 different questions. I usually inform them about some of the similar sounding questions that might require them to organize similar ideas that we've already practiced, and that usually decreases the workload by 4 to 5 times. This saves time and affords candidates time to focus on other critical aspects of residency interview process, which I've already discussed in my previous podcasts. Now we can talk about some of the most common residency questions and how to answer these. You could be asked these questions in several different forms, and like I said, if you were to look at 100 sample questions available online, these essentially draw their answers from similar ideas. So today we will discuss 3 most common questions that are asked during the residency interviews. Now the first question is, tell me about yourself, or what brings you here today. This is the most common question that candidates would be asked during their interview trail. It's oftentimes a good opening question because it doesn't require much of a thought from the interviewer, and it also forces the candidate to be creative, and it's open-ended. It can be a challenging question though because it is relatively open-ended. You can use that open-endedness to craft an answer that satisfies the interviewer's curiosity about getting to know you as a person. It also allows you to add content and ideas that express your strengths as a candidate. A good strategy is to start with something personal and pleasant, like where you're from, while you organize some ideas in the back of your mind. This can be followed by you describing your experience as an applicant so far and how this experience has molded you into the right candidate. You can also end this question creatively by talking a little bit about your hobbies, and that usually helps in transitioning from a more formal interview pace to something more casual. And it often also decreases the anxiety when you meet a new person. What are you looking for in a program, or why this program, is another question that candidates oftentimes get asked. Now, this is the program gauging if you know what you want. It is also a way for them to look at how interested you are in their program. The best way to answer this question is to summarize what you're looking for in terms of training. For example, a diverse population, specific research interests, etc., followed by how that program addresses these needs. So basically, you create a problem and summarize the problem. And then you tell the interviewer how the program offers a solution to the problem you present. This may seem like an easy question, but it is one that you should create bullet points for before each interview, since you will be interviewing at programs of different levels and strengths. Another common question that is asked is, why would you be a good fit for this program? Or why should we rank you highly when we have so many other candidates to consider? Now, this is an interesting question where you can draw quickly from the ideas that you have been reflecting on, your strengths, your personal experiences. As you summarize these in a conversational manner, follow each of these by how this makes you better, how your experiences have contributed to qualities such as work ethic, reliability, you being a hard worker, a team player, having exposure in different settings, and exposure to different culture. Cultural competency is becoming more and more important in practicing medicine in the United States. And if you have worked in other cultures or have global health experience, I think this is a great opportunity to highlight that experience. We will follow up on this discussion with more questions in our upcoming podcasts. I really value the emails and phone calls and messages that we receive as feedback. It helps us develop our content in a way that it addresses the needs of the applicants better. I read every email and I go through every message personally and try to address those as soon as I can. Since the interview season is fast approaching, this can be a difficult time for most candidates. The comprehensive interview preparation program at IMG Rank to Match is geared to prepare candidates in effectively interviewing for these positions. If you have any questions about our programs and the services we offer, please visit www.imgrank2match.com. Also, if you have any feedback, please feel free to email us at clientsupport@imgrank2match.com. I personally go through every email that you send me, and this greatly helps us in improving our content. I appreciate your time listening to this podcast. Until next time, this is Dr. Kahlon from IMG Rank to Match signing off. Good luck, everybody.